How long after a hair transplant will grafts become fully secure and not be dislodged, even with vigorous massaging and shampooing? 15 days after 4,000 graft hair transplant, my scalp still had some big scabs, so the doctor advised me to massage my scalp while shampooing a bit harder than before in order to remove these scabs. I followed his instructions, but I'm worried that I dislodged some grafts since a few scabs looked like clotted blood and had hairs attached to them. However, there was no bleeding, pain, or redness. How long after hair transplant are grafts secure and can't be dislodged, even with vigorous massaging?
Thank you for your question. You submitted your question with a single photo, and you stated in your question you're 15 days after undergoing 4,000 hair grafts, and that you are a little bit concerned about potentially dislodging grafts because there are a lot of scabs that seem to be attached to hairs, and you want to know how safe it is to essentially be aggressive about shampooing, and at what point after surgery are these grafts in a secure enough position not to be dislodged. Well, I can certainly share with you how I have counseled patients for many years performing hair transplant. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I'm also the founder of Tricostem Hair Regeneration Centers, a system we developed using extracellular matrix and platelet-rich plasma to help patients expedite healing after hair transplant. And this is actually a treatment we've developed that has evolved into a very significant non-surgical treatment for men and women with androgenetic alopecia, or genetic pattern hair loss, in addition to people who have had hair transplant who want to further manage their hair loss beyond the time of their transplant. So to answer the question as to when is a graft basically secure, I would say, from experience and doing every different kind of hair transplant technique since the mid-90s, I would say that within 48 hours a hair graft is pretty well secure. If a graft is above the skin and attached by a clot, well, that's not a graft that's going to make it anyway, and a certain percentage of grafts do not make it. And that was, as I said, one of the reasons we developed what ultimately became hair regeneration, was to help people during the time, the critical period, as well as beyond the critical period, to expedite healing. The biggest challenges with transplant was especially with the strip method, was to get the donor area to heal as well as possible, and get the grafts to heal as well as possible. When you think about it, you got 4,000 grafts. That means you had 4,000 incisions made into your scalp. That's fairly traumatic. It's there's a fair amount of bleeding, and there's a fair amount of inflammation. We found that with extracellular matrix and platelet-rich plasma that we got improvement in the healing of the donor area as well as graft survival, and as an additional benefit, we found that thinning hair became thicker. From this, we developed hair regeneration, Tricostem hair regeneration, where people with male and female pattern hair loss are also able to manage their hair loss with this treatment where injections are placed into the scalp to reactivate hair that isn't growing, to thicken thinning hair, and to prolong the lifespan of hair that is thinning. Now, depending as far as over the past 7 or 8 years of doing this, I've also developed a classification system further to optimize the dosage and delivery techniques to maximize the output and coverage of every patient, in addition to the use of any other pharmaceuticals such as DHT blocker like finasteride and minoxidil when appropriate. As far as patients who have had hair transplants are concerned, again, I would say that going back to your question, you may wash your hair aggressively. I can tell you that whenever we would tell our patients to wash their hair aggressively, we found that they would still be very tentative about washing their hair, and some patients would actually ask them to come into the office and my technicians would wash their hair, and they would realize that they were not being aggressive enough. At a certain point, you have to scrub the scalp to get rid of the dead skin as well as the scabs so that the scalp can actually heal well and existing hair isn't affected by poor scalp hygiene as well as the grafts themselves. But by 48 hours to 72 hours, it would actually take an instrument to remove those grafts. So I think you can feel secure about that. As an aside, I can tell you that a lot of patients who have come to us have had transplants done elsewhere, and we've actually been able to expedite the regrowth process as well as help the existing thinning hair when they come in somewhere between the 1 and 3 month point after undergoing a transplant and doing the injection of hair regeneration. There's a protocol for that as well. That's not saying that you need that, but it's just to help you understand the wound healing process. Wound healing is still a physiologic process that has a pretty stable schedule. There's a hemostatic phase, inflammatory phase, proliferative phase, and then remodeling phase. And those processes will take their own time, and thanks to newer technologies, there are ways to help further expedite different stages of that process. And this is something you can certainly discuss with your transplant surgeon. So I would encourage you to wash your hair, and you expect that you will see some grafts not quite make it. When you do a transplant, the bleeding can push some of these grafts up, and some of them may come out regardless. And whether or not they do come up, I've had, for example, patients who have had mega sessions done elsewhere and had lost 90% of their grafts. So I don't want to scare you, but understand that there's a certain amount of attrition that happens with every transplant, and hopefully as long as everything goes as planned, you'll get the desired outcome. Certainly, you've already experienced how hard it is to have hair transplant and how many hours it took to have it done. So I know your surgeon wants the best outcome for you, but you should follow your surgeon's advice as to washing your hair to appropriately maximize from your side whatever can be done to help your transplant heal. So I hope that was helpful. I wish you the best of luck. Thank you for your question.